Hi there, my name is Lori Chern from RN Collaborate. Today is September 12th, 2023. The RNC Restorative Health Program is developed to help you understand how to maximize your own unique and optimal level of health. This is the first of a 7-part series on restorative health. It will focus on chronic inflammation, what causes it, and how it causes many of our diseases and symptoms. This illustration simplifies the progression of diseases and the symptoms that we develop. We usually present to our healthcare provider when we develop symptoms. Common symptoms as listed include chronic pain, gastrointestinal symptoms such as bloating and irritable bowel, high blood pressure, anxiety, depression, foggy brain, obesity, neuropathy, infertility, erectile dysfunction, and accelerated aging. These symptoms are all mostly caused by the diseases listed above, including diabetes, cancer, irritable bowel syndrome, cardiovascular disease, Alzheimer's disease, Parkinson's disease, fibromyalgia, food allergies, autism, Crohn's disease, anxiety and depression, erectile dysfunction, PCOS, which is polycystic ovarian syndrome, dyslipidemia, which includes high cholesterol and atherosclerosis, hypertension, retinopathy, which is damaged blood vessels to the retina, kidney disease, which is nephropathy, multiple sclerosis, and macular degeneration. All of the diseases and symptoms listed are caused by the progression of 3 causes, which above you will see A, dysregulation of blood sugar, B, which leads to insulin resistance, and then chronic inflammation. This episode will be the most comprehensive of the program as it is the basis of all further learning in which we'll learn to decrease these 3 causes. We have somehow evolved into a society into eating dessert for breakfast, which include waffles, bagels, croissants, flavored yogurt, and dried cereal. The breakfasts just shown are high in refined carbs and sugar with little or no protein. The purple line on this above graph on the slide shows how blood sugar responds to foods like these. Once we eat breakfast like this, our blood sugar spikes too high out of our normal range and then crashes below our normal range, as you see extremes depicted on the graph. When we crash, we may be moody, irritable, and lack energy, and our body and brain subconsciously need fast carbs to quickly absorb, and therefore our cycle for the day or days begin. We wonder why we have no energy, feel tired, and don't feel like eating a healthy meal. This continues for the rest of the day as we have set ourselves up for patterns of hunger and tiredness by eating dessert for breakfast. The next 2 slides illustrate high protein breakfast with low carbs. This breakfast is approximately 20 grams of protein with no refined carbs. So 2 of these eggs would be about 40 grams of protein with the cheese and meat in the middle. Protein shakes are an excellent source of protein for breakfast or any meal or snack. At the end of this presentation, I'll post a recipe that has approximately 46 grams of protein. As we see in the graph again, dessert for breakfast is in the purple line that spikes and crashes throughout the day. And then the green line in the middle depicts how you start your day with high protein content for breakfast. Blood sugars stay within the ideal range because protein does not spike glucose. Therefore, blood sugars are maintained nicely throughout the day and we do not feel irritable, moody, or tired. Every time we eat, our pancreas releases insulin. The higher the spike, the more insulin our pancreas releases. The more frequent we have spikes, again, the more insulin our pancreas releases. Insulin is a hormone that drives blood sugar out of the bloodstream and into our cells. If an excessive amount of insulin is released daily, the insulin ends up driving the blood sugar to be stored as belly fat. In the illustration above, the long tube-like figure on this slide is our blood vessels, showing that after we eat, blood sugar rises in our bloodstream as noted by the sugar cube looking components in the blood. And then step 2 shows as our blood sugar rises, our pancreas releases insulin into the bloodstream, as depicted by an actual key figure. And then step number 3 shows our cells that have insulin receptors, as noted by the starred figure. We have these insulin receptors in our liver, our muscle, and in our fat. And then step 4, the insulin meets the receptor on the cell and goes to step 5, which once insulin attaches to the receptor, it unlocks the code to allow glucose into the cell, which happens in step number 6. Here's another slide showing the pancreas at the top releasing insulin into the bloodstream and then attaching to the cell receptor to facilitate blood sugar absorption. An insulin receptor is circled in blue in the middle of the slide. However, when insulin is secreted too often or too much, the insulin receptors may wear out and change from 100% effectiveness and efficiency to only 25 to 75% effectiveness and efficiency. This is now called insulin resistance. Insulin resistance leads to chronic inflammation. Chronic inflammation can rear its ugly head in a variety of ways in your body and cause many diseases and symptoms. So chronic inflammation in the brain may cause neurodegenerative diseases such as Alzheimer's, autism, Parkinson's, and ALS, or symptoms such as foggy brain, headaches, and decreased energy. This slide shows a nice clean artery above with normal blood flow, and then the artery below it has significant inflammation, and because of the narrowed inside diameter, blood flow is now decreased. Chronic inflammation in blood vessels may lead to atherosclerosis, which is hardening of the arteries, hypertension, which is high blood pressure, a cerebral vascular accident, which is a stroke, congestive heart failure, peripheral artery disease, coronary artery disease, carotid artery occlusion, myocardial infarction, which is a heart attack, and cardiac arrest, which is sudden cardiac death. It also may lead to erectile dysfunction. On the right, we can compare a normal colon to the inflamed colon with ulcerative colitis and Crohn's, which are both very painful. Inflamed intestines cause ulcerative colitis and Crohn's disease, and therefore very important to mitigate any inflammation in our gut. Chronic inflammation anywhere in the gut can also cause a variety of symptoms such as bloating, cramping, and diarrhea. Chronic inflammation can also cause leaky gut, which happens when our intestinal lining is only one cell thick, which separates us from a sewer system inside, as you see in the illustration above. This is why we cannot have any chronic gut inflammation otherwise, as noted on the right-hand side of this illustration. Cells get inflamed and angry, leaving spaces in between them for bacteria and other intestinal contents to leak into our bodies where they are not supposed to be, causing us to have systemic infection problems, inappropriate immune responses, and increased risk of cancer. Chronic inflammation of the nerves can present in a variety of different diseases and symptoms such as multiple sclerosis, peripheral neuropathy, fibromyalgia, erectile dysfunction, and chronic pain. Chronic inflammation in the heart may cause atrial fibrillation and other arrhythmias, in addition to inflammation in the heart's layers such as pericarditis and myocarditis. Chronic inflammation in the blood vessels that feed the retina may cause retinopathy. Chronic inflammation to the macula of the retina may cause age-related macular degeneration. Both retinopathy and macular degeneration cause irreversible blindness. Cancer. So chronic inflammation causes our immune system to inappropriately respond to the inflammation while neglecting other pathogens that grow in our body. Cancerous cells also love to feed off the blood sugar spikes from our ingested refined carbs, which causes our inflammation. And then unchecked cancerous cells also inappropriately proliferate, which causes inflammation again. Therefore, chronic inflammation has at least 3 identified pathways in which it facilitates cancer growth. So returning to this slide, the amount and frequency of insulin receptors from our pancreas depends on both the frequency and how much that our blood sugar levels are elevated. Therefore, frequent elevation and higher elevation of blood sugar makes our pancreas secrete more insulin. The more insulin that we secrete, the more inflammation that occurs. Oversecretion of insulin facilitates blood sugar getting stored as belly fat. The progressive illustrations above depict how belly fat evolves into visceral fat. Visceral fat is very dangerous as it surrounds and infiltrates our vital organs. Our organs do not like fat in them. Fat in our organs makes the organs less efficient and effective, which then lead to other disease symptoms. Here's a frontal view of visceral fat and how it surrounds and infiltrates our organs. We return to this slide to review most of the symptoms and diseases discussed, and then re-review the causes of these diseases again, which include dysregulation of blood sugar leading to insulin resistance and visceral fat storage, and then eventually to chronic inflammation. When we go to our healthcare provider, we present with symptoms, and then our symptoms are either clustered for a diagnosis or our symptoms are treated. But we can go a step further and start to address the causes of most of our diseases and symptoms, such as dysregulation of blood sugar and our chronic inflammation. One way to help decrease our risk for blood sugar dysregulation, insulin resistance, and chronic inflammation is to incorporate at least 30 grams of protein in our first meal of the day, which is breakfast. This will help regulate our blood sugar significantly, as illustrated in green on this graph. Noting on green, we do not have any spikes and crashes, and our blood sugar is maintained at a steady level all day. This decreases any excessive insulin release and decreases significantly our risk for chronic inflammation. So 4 ways to help decrease blood sugar spikes include: number 1, ensure you consume at least 30 grams of protein at each meal. Strive for at least 1 gram of protein per kilogram of weight for your total daily intake. For example, the 75 kilogram person should consume at least 75 grams of protein daily. Number 2, don't snack. Another opportunity for blood sugar to spike with an unnecessary insulin response. Remember that excessive insulin secretion drives blood sugar to be stored as belly fat. Number 3, use a continuous blood glucose monitor for a month to observe how you uniquely respond to certain foods and what foods in particular spike your blood sugar, so that you refrain from these foods as much as possible in the future. You do not have to have diabetes in order to monitor your glucose level. Number 4, consider time-restricted eating behavior, which may be 12 to 16 hours of not eating overnight, and this will be discussed in detail in a future episode. Here are some foods that are sources of protein. You may resource or Google any food to determine protein content along with other nutritional factors. The first 5 are traditional meat-sourced protein. And we got egg, we got any kind of nuts. You can always Google how much protein in each nuts. Then you've got your milk-based products, which are plain Greek yogurt and cottage cheese and milk. And then our cheeses, and then our beans and lentils. And then, of course, peanut butter is a good source also. So your body tries to compensate for blood sugar spikes for at least 10 years before insulin resistance starts to happen, and then we see insulin resistance show with abnormal lab values such as elevated random glucose and A1C, along with resultant disease processes. And then another not so fun fact is that Alzheimer's starts in the brain at least 10 years before symptoms present. The end. References. And then here's the recipe I use for a protein shake every day. So it contains 46 grams of protein. Thanks for watching.